So once again, thank you for everyone joining us today. And we're like I said, we're gonna go through the benefits of the CFU Elife and how it's going to help your clinic and take it to the next level. Um, during this webinar, after at the end, you're going to get a link for a registration for a certificate. If you fill that out, then we can basically you can claim that certificate, and then we'll also send out a free ebook as well. So yeah, I think I'll give you a little bit about a background about Biotec. So Biotec has been around since 1993. The one of Europe's leading aesthetic and medical device manufacturers. And the main focus has been on like non-invasive devices that use their own body's mechanism of action to get the best results. What we feel is that the way the industries are working and moving towards, more people are coming off more injectables, they're getting more into technology treatments, and that is where really there's a big growth there as well. So we're going to learn today specifically about the CFU Elife, and it's one of the best-selling devices right now. And we'll go through in more detail as well. So I'll pass it over to Jessica, and hey, Jessica, if you can start the presentation, and we'll take it from there. As people join us, we can just continue from there. Yeah.
Okay. Thank you, Bhavesh, for your presentation. Hello again, everyone. I'm Jessica. I'm a biomedical engineer and I'm the expert clinical educator of Biotec Italia. Now I share with you my PowerPoint presentation. Please tell me if you can see it.
Yes. Yeah.
Okay. Just one technical things. While I'm presenting the PowerPoint presentation, can I make you, Bhavesh, be the owner of the call?
Yeah, sure.
So that if someone comes in,
Yeah.
so, sorry, 1 second. Uh, okay, now you should be the,
Great.
okay. Okay, so we are ready. The device I'm going to talk about is the CFU Elife, which is one of our best device, I would say, is one of our cutting-edge technology with also the X-rays, as Bhavesh was explaining before. I every time want to start with the key points of each of our device. Probably now you will not understand so much about these points, but going on with the presentation, I will go too much more into these details and you will understand more. So, why we can consider the CFU Elife as the best HIFU in the market? Because, first of all, we don't have any consumables, because we don't have any cartridges, and later I'm going to explain you better why. More comfortable treatment, faster procedures. Centerless is a key word. Centerless means that there is not the emission of ultrasound directly from the center of the ultrasound, but from the edges. And this will create microcoagulation points, which is a very important thing. And finally, thanks to this device, we are going to achieve extraordinary results. First of all, what is the main purpose of the CFU Elife? Is the face for a non-invasive facelift, reduction of wrinkles and skin laxity, and skin tightening and rejuvenation. This is the main target of this device. But as secondary purpose, we can also treat the body for the reduction of localized fat and the treatment of hyperhidrosis. In order to better understand this technology, we have to start from its meaning. CFU stands for Centerless Focused Ultrasound. The word centerless is a very important word, is a key word that distinguishes the CFU from the traditional IFU. And later we are going to understand better what does it mean. But now let's concentrate on ultrasounds. What are ultrasounds? Are acoustic waves at a very high frequency, more than 20 kilohertz, which means 20,000 of emission of pulses in 1 second. So you have to consider, to imagine something like this with respect to this. So you can understand that having a lot of pulses in 1 second, these ultrasounds are able to penetrate deep into our biological tissue. They can reach the epidermis, the dermis, also the deep dermis, and the SMAS, and they generate vibration between our biological molecules. This vibration generates thermal energy in the form of heat. When the intensity of this thermal energy reach a temperature of 65 to 70 degrees, so very high, very intense temperature, what does it happen? We generate the so-called thermal coagulation points, which are these small dots that you can see. Basically, they are small thermal damages, small points where all the energy of the ultrasound is concentrated. It's very important to understand that they are localized damage. The energy is concentrated only in this specific point without spreading and damaging the surrounding tissue. When we create many of these coagulation points at different level of our biological tissues, the SMAS, the deep dermis, and the superficial dermis, what does it happen? We have an important biological response. As immediate effect, we have the contraction of collagen fibers. We call it shrinking effect. And it is an immediate effect because immediately after the treatment, we can feel our skin more compact and more tight. And the long-term effect, which is the more important effect, is the neocollagenesis, regeneration of new collagen fibers. But why is so important these fibers of collagen? Why is so important this shrinking effect and this neocollagenesis effect? To understand it, we need to know what does it happen to our skin when we get old with the process of aging. It happens that our fibroblasts, so the cells that compose our skin, decrease their activity, and so they produce less collagen and elastin. Collagen and elastin are the two fundamental proteins that gives to our skin the compactness, tone, and elasticity. And so losing more collagen and elastin, what does it happen to our skin? We lose tone and firmness and elasticity, wrinkles appears, and we increase to have skin laxity. These, you can agree with me, I think that these are the three most common signs of aging. So, what can we do in order to prevent these signs of aging? I mark that the aging process is a natural process and we cannot stop it. Unfortunately, everyone is going to age and to have these signs of aging, but we can try to prevent these signs of aging and to reduce their appearance. What we can do is working on this mass. I don't know if you know what is the SMAS, but I try to make you understand better. The SMAS is a connective layer which is in between the muscles and the skin, in particular the subcutaneous tissue where there is the fat cells. The SMAS is sorry?
Yes, fine.
Fine, okay. This mass is a fibrous connective layer, is in between the dermis, the subcutaneous tissue and the muscles. This mass is very important for a lifting effect. Just to give you the idea, I usually compare this mass as the foundation of a house. This mass is the foundation of our face because it is what gives to our face the structure, the compactness, the oval shape of the face. In fact, one other problem of the aging is that when we old, when we age, instead of having an oval shape, with the skin laxity, we are going to have a square shape. You can agree with me about this. So, working on this mass and generating many of these thermal coagulation points at the level of this fibrous connective layer, we are going to stimulate the structure and the compactness of our face, but in a natural way. This table is just to show you that the CFU, so the ultrasounds, are the only technologies that can arrive till this mass and stimulating this mass. All the other technologies for aesthetic medicine in the market, like laser, IPL, radiofrequency, fractional radiofrequency, can arrive only till the dermis. So, for example, the radiofrequency, which is one technology that can be compared with the CFU, because radiofrequency generate heat, thermal energy, as well as CFU. But this thermal energy can only stimulate the dermis, the deep dermis. So we can have a tightening, yes, a little bit of tightening effect, but it is very superficial. But what we really want to target is this mass, and only CFU can do it. This is just a short video showing you the biological process that I explained to you. So these are the thermal coagulation points we are going to emit with the transducer. Of course, we are going to generate many of these points. We are talking about 4,000 of points, more or less. This is the neocollagenesis, so regeneration of new collagen fibers, and this is the final lifting effect. So we have covered the part of the face, which I remember you is the main focus of the CFU. And now let's talk about the second purpose, which is fat reduction. I want to mark that we are talking about localized and small adiposity. We are not talking about losing weight or fat reduction in large areas. We are talking about a small area. Usually we work on 12 per 12 centimeter, just to give you an idea. How does in this case ultrasound work? Again, we are able to generate thermal coagulation points at a temperature of 65 to 70 degrees. And these thermal coagulation points, which are generated in this case at the level of fat cells, adipocytes, bring to the raptor, yes, they break the membrane of the adipocytes. So all the content of the adipocytes are released outside in the interstitial fluid, and they are removed by phagocytosis, by our lymphatic system. This is basically the process. It is called lipolysis, and as a result, a reduction of the volume of the adipose tissue. And finally, the third result we can achieve with the CFU is the hyperhidrosis. Hyperhidrosis is a medical condition which is characterized by an overproduction of sweat glands and an overactivity of sweat glands, which brings to a sweating activity. It is independent from the temperature or of the physical activity, so it is a real medical condition. Again, focused ultrasounds are able to generate thermal coagulation points at the level of sweat gland. And what are the results? The first short-term effect is the reduction of sweat activity of the sweat glands. And the long-term effect, which start 2 weeks more or less after each treatment, is the reduction in the number of sweat glands. So we have this double effect, which is really important for hyperhidrosis treatment. Okay, now I have talked about the main clinical aspects of the CFU life. Let's talk about the differences of our CFU with respect to traditional IFU. Because I mean Biotech, tried to take the traditional HIFU in the market and to solve some of the problems of the traditional HIFU. So we are going to see all these details, the centerless, the fact that we don't use any cartridges, and the easy zoom and easy flow technology. Let's start from centerless. As I anticipate to you in the beginning, this word is very important, is a key word in order to understand this technology. Centerless means without center, and in fact, our transducer has a hole in the center, so it means that basically ultrasounds are not emitted directly from the center like standard HIFU, but from the edges. You have to imagine the emission of ultrasound in the CFU as a cone, so the ultrasound cover the lateral area of the cone and concentrate only on the top of the cone. So as a result, we have a microcoagulation points, so a very small points compared to the standard HIFU, where thanks to the due to the fact that they emit ultrasound directly from the center, have a bigger thermal coagulation points. In these slides, you understand better the difference. So this is the points, the microcoagulation point of the CFU, and this is the shape of the macrocoagulation point generated by the standard HIFU. You can see that the point spread a little bit and interfere also with other biological tissue. So, as you can see, in fact, in this point. So, as consequences, we have pain and the risk of superficial burns. Why pain? Because our receptors of pain and heat are located in the epidermis. So, if we also affect the epidermis with this pain and thermal receptor, we have more pain and risk of superficial burns. But we also have more recovery time and we have less precision because imagine the same energy which is concentrated in a bigger point or in a smaller point. Which one is more effective? The one which is concentrated in the smaller point. Can you see me again? Because I see me stop.
Yeah, we can see it.
Okay.
Yes.
Yeah.
Good, now you can see me. Okay, I just want to check. No, okay, I saw a few messages in the chat, but okay, I go on. Everything clear for the moment, or are some questions?
Yeah, it's good for me. Anyone got any questions at this stage? No.
I don't think so.
No.
Okay, I go on. At the end, we have free time for any questions. So, I was telling you that due to the fact that due to this shape of the standard HIFU, we call it a cigar shape because it's very similar to a cigar. We have more pain and risk of superficial burns because we also affect the epidermis. More recovery time, less precision in results because the same energy is concentrated on a bigger point, so we have unfocused energy. And very important thing, we have the risk of fat reduction in the face. But in the face, you can agree with me that we don't want to have fat reduction because if we have skin laxity on the face and we reduce the only fat we have, we increase the condition of skin laxity. This is instead a picture showing the shape of the thermal coagulation point with our CFU, so with the centerless transducer. all these side effects that we have with the standard HIFU, so pain, superficial burns, more recovery time, fat reduction, are avoided. So everything fine, but a lot of time people ask to me, but if I really want to reduce fat in the face, for example, on the double chin, we have usually fat. What we do in this case? In this case, we can work on the pulse duration. The pulse duration is the time we give to the ultrasound to spread and to diffuse into our biological tissue. We can work from 50 millisecond to 2000 millisecond. So look at this table. You see that if we use 50 millisecond, we have a small point, which is useful for the face where we don't want to reduce fat, but we only want to have a tightening effect. But if we want to work on the face, what we can do? We can increase the pulse duration up to 75, 100 milliseconds. So we create a bigger point and we are also able to reduce fat, for example, on the double chin. So this is for the face, this is for submental fat, and 200 milliseconds, as you can imagine, is for the body fat reduction. So, regarding the advantages of the CFU with respect to traditional IFU, we have talked about the centerless meaning, and now let's talk about the easy zoom. I start showing you this video. This is the working flow of the traditional IFU. They emit thermal coagulation point at one depth, and then when they want to change focal depth, they need to change also the cartridge. For example, now they are going to work with the 4.5 millimeter. And this is all the working procedure. So every time the operator want to change the focal depth, because you know with ultrasound, with this ultrasound, we need to create thermal coagulation points at different depth, at 4.5 in the SMAS, 3 in the deep dermis, and 1.5 in the superficial dermis. And every time they want to change the focal depth, they need to change the cartridge. Instead, with our CFU with the easy zoom technology, we just rotate the metal plate in the handpiece and we are able to change the focal depth. I show you again. So you can see that we have two handpieces. This is for the face and this is for the body. For the facial handpiece, we have three focal depth, 4.5, 3, and 1.5. For the body, we have four depth, 13, 11, 9, and 6 millimeter. So you can imagine that with this easy zoom technology, we have faster treatment because we don't need every time to change the focal depth. We have easier movement and any consumables because we don't need any cartridges. Now, let's talk about the easy flow technology. Again, before to tell you what does it mean, I want to show you this video. Traditional HIFU works with the cartridges in lines. What does it mean in lines? It means that they place the cartridge, the handpiece, and they emit. Then they move and they emit, and they work like this. But this procedure is very slow, and another very important thing is that working in this way is very difficult to cover perfectly all our anatomical contours of the face, because our face is not made of lines, but it is made of curves. I show you instead the working flow of our CFU. You see how faster is the movement, first of all, but also how easy is to cover all the anatomical parts and contours of the face. I show you also this video. Look how easy is to cover the anatomical contours of the face and also the double chin. which is a difficult part to reach with the traditional IFU. Is it clear?
Yeah.
So let's come back to these slides. Easy flow means that we have an emission of a series of pulses of different speed. Why different speed? Because we can adjust the frequency from 1 to 10 hertz. What does it mean 1 and 10 hertz? Means 1 emission in 1 second, so very slow, up to 10 hertz, so 10 emission in 1 second, very fast. Of course, we can work from 1, 2, 3. For example, usually I work from 6 to 8 hertz because for me, less than 6 hertz is too slow, but more than 8 hertz is too much because I cannot be so precise. So we can move easier, work faster because in 25-30 minutes we can complete a full facelifting. And as I told you, we can perfectly follow all the anatomical contours of the face.
Yeah.
Okay, so we have talked about the centerless, the easy zoom, the easy flow. Another very important system in our CFU is what we call ACE cooling system. ACE stands for active cooling emission. First of all, why we need a cooling system in our CFU? Because we are working with ultrasounds, and ultrasounds are very high energy, is a very powerful type of energy. We are working with 20,000 kilohertz frequency. So we need a cooling system in order to dissipate heat because we can overheat the transducer and we can decrease the durability of the transducer. And water is the anatomical, the natural medium that faster and better dissipate heat. So we have a cooling circulating system inside the handpiece that works with double distilled water. And the most important thing is that this water inside is not static like in traditional IFU, but it is dynamic. This dynamic system allows to dissipate better and faster the energy of the ultrasound, increase the durability of the transducer. This system, the ACE cooling system, is the one that allows to us to emit up to 10 million of pulses for each handpiece. And this cooling system also increase the comfort during the treatment and decrease the pain felt by the patient. So, in conclusion, what are the main differences of our CFU with respect to traditional IFU? That we don't have any consumables because we don't have any cartridge, and as Bhavesh probably will talk to you later, the cartridges are a consumables, so they have an important cost. So it is a very important economical advantage. The second advantage is that we can do faster treatments because, as I told you, in 25 or 30 minutes, we can complete a full facelifting. For the body, it's difficult to predict the timing because it depends on the area on which you want to work, and it depends on how many depths you are going to work. So it is difficult to predict, but it is not so long. We have better results because of the fact that the transducer is centerless, so we don't have bigger point with less precision and risk of fat depletion, but we have smaller point for better results. Any downtime for the patient, and of course greater patient satisfaction. I don't want to stay to talk to you too much about the practical part. I just want to concentrate on the clinical aspects, but I just want to show you that the treatment is very simple. These are all the steps. So first of all, of course, it's important to evaluate, to have an anamnesis of the patient in order to evaluate the features of the skin. So evaluate the age, the skin quality, the thickness of the face, the fat distribution, and the general health in order to know, first of all, that we can perform the treatment, but also to select the most appropriate parameters. Then removing the makeup, impurities, and sebum. Apply the gel. This is a very important step because ultrasound, for their nature, can be conducted only thanks to a water medium, so only thanks to a gel. So this is important not only because it allows to move, to slide better, but also because we can conduct ultrasound better and easier. Then we select the parameters every time respecting the feedback of the patient. We recommend that it is better to start with low parameter, ask the sensation of the patient that needs to feel some very small needles, which correspond to each thermal coagulation points, but any pain. And depending on the feedback of the patient, we can increase the energy. Then we do the treatment. What is very important is to be every time perfectly coupled to all the anatomical parts of the face, so to be perpendicular. And finally, clean the gel, clean the face, remove the gel, and apply some soothing cream. Why I tell you soothing cream? Because this is the endpoint. So nothing too much, but there is a diffuse or punctiform redness, and sometime, only in some cases, it can also appear some swellings on some parts of the skin. But don't worry, these are reactions that disappear in a few hours, and they are not. They are reversible, so they stop, they disappear after a few hours. Finally, I want to conclude with some frequent questions that sometimes people ask me. What is the duration of applicator? The small applicator can have 10 million of emission of thermal coagulation points, and the big applicators, so for the body, have more than 10 million. So, how many treatments more or less can we do? For the face, we can do more or less 1,000 treatment. For the body, it is very difficult to predict because, again, it depends on the area you want to work on. It depends on how many depths you're going to work. But just to give you an average, we can do 500 treatment. Another very important question, after how long will I see the first results? I mean, is it an immediate procedure? After the treatment, can I see the result? It's difficult to answer, but immediately after the results, you can see the skin more compact and more firmer. But it is not the real result. I call it the flash effect. The real results, for the real results, you need to wait at least 2 or 3 weeks after the treatment. Why? Because the real important process for the rejuvenation effect is the neocollagenesis, and the neocollagenesis needs time. So it starts after 2 weeks from the treatment. That's why you have to evaluate the results after 2 weeks, 2, 3 weeks. And finally, how many treatments should I do? And after how many time can I do the second, third treatment, and so on? These are our protocols of biotech. Of course, they are only some indications, but every operator can choose, adjust the time based on his experience. For example, for the face, we distinguish between soft aging with 3 sessions, medium aging 4 sessions, and severe aging 5 sessions. For example, for the soft aging, we can do the first session, the second after 3 months, and after 6 months. Let's see instead, for example, for severe aging, we can do the first 3 sessions at a distance of 1 month. Then for the fourth session, we wait 2 months, and after 3 months, we do the last. For each of these 3 conditions, we can do also a maintenance session every 6 months or every year. For the body, let's see for tightening and fat reduction. We suggest, again, it's difficult to predict how many sessions because the body is something very subjective and depends from a lot of features. But to give you an idea, for tightening, we need from 4 to 8 sessions. For fat reduction, from 4 to 12 sessions. And we can do every month. Again, we can also consider a maintenance session every 6 months. Regarding hyperhidrosis, we can need from 2 for 4 sessions, again, depending on the condition of hyperhidrosis, and we can do each session 45 days apart. Another important thing, so what are the contraindications of this treatment? Of course, pregnancy and breastfeeding, like every device, pacemaker, herpes, of course, in the area where we are going to treat, coagulation disorder or therapy of anticoagulants. Be careful in the case of rosacea or varicose veins. They are not properly contraindication, but they are some condition where ultrasound can make the condition worsen because ultrasound create thermal energy. Thermal energy, so heat can cause vasodilatation of the vessel and can make the condition worsen. Then be careful about sun exposure. Wait at least 15 days after the treatment in order to expose directly to the sun, I mean to go to the sea, for example, and apply sun cream 50 plus. Be careful about liposuction because you have to wait at least 2 months after a liposuction to do a CFU treatment. And what about injection, which are really important nowadays? For Botox, it's important to wait 1 month after the injection in order to do the treatment of the CFU. Regarding the fillers and the medical thread lifts, 2 months after this in order to do a treatment of CFU. Instead, regarding mesotherapy and biorevitalization, there are any contraindication. The contrary, we suggest to do especially before the treatment of CFU. Why? Because with mesotherapy and biorevitalization, so delivering actives, we increase the hydration of the skin. And again, ultrasound can conduct it better thanks to a water medium. So the hydration helps again to have better results also with the ultrasound. And finally, let's see some results. This is after 1 session and after 1 month from the session. Look at the wrinkles in the periocular area, how they improve. And also here, these wrinkles. But also look how the texture of the skin improves, how the luminosity of the skin improves. Another results. Here I invite you to look at the how you call it, this wrinkle here, but also how the shape of the face is come back to the oval shape of the face. Another is after only one session after 1 month. Look especially in this area where we have more skin laxity, but also the wrinkles and again the texture of the skin, how it is improved. Another result, this is after 3 sessions, so a longer procedure. Look the wrinkles here, how they improve, but look also the double chin and the neck, the skin laxity in the neck. And again, look this part where we are more prone to have skin laxity, how it improves. Another nice results, look the wrinkles in the forehead, look the wrinkles here near the eye and here near the mouth, the nasolabial wrinkles. Another results after 2 sessions, look all these wrinkles, how they improve. This is one amazing results for me. Of course, it depends also from the condition on which you start. If you have more signs of aging, like skin laxity, wrinkles, skin loss of tone, elasticity, and so on, you will have a better results, of course, because you are working on different problems. And this is an example. You can see how amazing is the results. Look all the wrinkles here in the face, but also on the neck. And some results on the double chin, which is one part where CFU is really effective. Look at this. This is after 2 sessions. Another one, I think it is after only 1 session. And finally, some results on the body. This is after 2 sessions, 1 month from the last session, on skin laxity on the arms. Another of skin laxity, it is after 3 sessions. Look how the skin laxity improves. I know the quality of this picture is not so good, but I think you can see the improvement of the skin laxity of the abdomen. And finally, localized fat reduction. Look here in the what we call culotte de cheval, in the tattoo, how it improves. It is after 3 sessions. And again, this is amazing for me. Look here again, the culotte de cheval, how they improve, and also this area. And look how more tone is the body. And I stop. I finish my speech. I hope it was clear and that you understand everything. My video stop again. Sorry.
There we go. Yeah. Thank you, Jessica. That was a great explanation on the device, and thank you for your presentation there. So before I go into how we can, help you with the equipment and get a little bit more in detail, does anyone have any questions about the technical side of the
Or
device?
clinical parts.
Yeah, if someone's just joined us just now as well, we can go a little bit detail about, what the device does. So yeah, if anyone's got any questions, please feel free to ask, or I can go to the next stage as well and show how we can help you with this device as well. Yeah. Okay, great. So I will share a little bit more information about the CFU device and how. Can everyone see my screen first? If a thumbs up or just yeah. Excellent, excellent. So I'm Bhavesh. I'm the UK distributor with Biotec Italia. We've been working together for many years, and I'm going to say how this device can help your clinic, as it's helped my clinic. So I also run some clinics as well, and the impact that this having. So initially, you need the right tools you need the right resources, and you need to have the right knowledge. Just a general insight from my perspective is that the aesthetic industry is always changing. So if you do not have the right equipment or have the right knowledge and understand what your clients want, it becomes very difficult when your competitors have those technologies or they have, the marketing backing as well. So today we're going to give you a full opportunity that not only we're going to help you with the equipment, but we're also going to help you with, the marketing side as well and how we can help. So I'll go into that. So why is the CFU the best device? So it's not just one device. It's a device that has multiple advantages. From the perspective of your business, you don't have to spend so much on consumables. It gives you a commercial advantage. The problem today, there's too many saturated treatment menus. Like if you've been offering the same treatments to your clinics for years without any change, not only you are probably getting bored of doing them, but your clients are probably getting bored of having those same treatments without anything new. And today, where there is an advance in technology and aesthetics, people want faster, longer lasting results, and that can only be done with technology and adding this technology as well. And also your staff will appreciate when you add. Those of you that have any staff in your clinics, I know it's important to show them that your clinic or your salon is going some places as well. And if you don't, have people that work for you yet, that, obviously having the tool there to bring more clients in, you will soon to expand. So to summarize, it's a non-surgical facelift that we focused on mostly, but it also does body as well. You've got skin tightening, pore refinement, hyperdrysosis, and it's high margin treatment as well. Like I'll give you an example. One of our clients recently bought a machine from us, and she was doing like eyebrow threading. And I said, how much does she make? And she said she only makes £4 per eyebrow. So I said to her, you'd have to do 100 eyebrows to just make £400. Um, Not only that's very hard to do, but you need 100 people to do that, or you could sell one package of an advanced treatment, like a HIFU or something like that, that could generate you that income. So it's about numbers there as well. So again, like Jessica said, there's no consumables, minimal staff time, high treatment capacity, and it can be bundled into a high ticket price as well. You can also combine treatments as well. So you could do like a HIFU treatment with a radio frequency. So you've got HIFU collagen production for maybe 2, 3 weeks down the line, and then you've got more skin tightening as well for with the radio frequency, and those treat packages sell at a higher price as well. So there's more advantages with having this device and the benefits it can bring to your clinic as well. So here is the breakdown of what you can earn. So let's say that you just done 5 treatments a week at £1,000. Your monthly revenue could, or even even your monthly revenue could increase, dramatically as well. Now, I've said the device costs at 750, but I'll go through that in a bit more detail. So in very low numbers, you can achieve high sales. So this just gives you an example of how much income you can achieve by adding this device to your business. So so I we obviously need to look at what else is a comparable. Now, one of the major factors why the CFU Elife is a game changer and evolution of the technology is that number one, there's no cartridges compared to something like Althera or the other HIFU manufacturers there, where you're stuck. You have to keep on buying cartridges. Another advantage, you've got up to 20 million shots. That will last you absolutely ages. You can do many treatments there for without any costs as well. So there's a massive not only saving but also a massive opportunity to earn great income here as well. So what we're doing as well, we're also partnered with Theo at ITH Media marketing support. And when anyone gets a device with us with this offer we have right now, we're going to generate 50 new client inquiries for you directly for your business, campaigned for your local visibility. All the meta ads will be managed by IHT Media, and creative assets as well, and ad copy and everything. So we'll deal with that because we've got the knowledge and the resources to know how it works. So I'm going to invite Theo to give a few words on how it's going to work and how he can help you to bring new clients in as well. So introduction to Theo. Here we go, Theo. Can you?
Hey, Bhavesh. Yeah, thank you
I'll
for the
stop.
intro.
I'll stop sharing for a moment so we can see your screen. Yeah.
Yep. All right. Well, thanks for the intro and for the presentation. Yeah, like as you mentioned, like one thing that a lot of clinic I think focus on a lot is, getting the best device possible, which is very important because then you can charge more. But you also have to think of like the marketing strategy to then be able to bring like more customers in um, for those patients. So one thing that we do with my agency is we help you get more customers for your treatments, your such as the CFU Elife device. So basically, what we do is we generate the leads for you, and then we have a sales team that will call the leads, so you don't have to do that, and that will take prepayment over the phone, so that you can just actually get people that purchase the package and get more like revenue through the door. Um, so yeah, we're partnering with Biotec Italia, and like if you go ahead and join us, you will get like 50 inquiries, for this device, and we will follow up with the leads as well. So you don't have to like chase people and yeah, basically just keep calling the leads, which can be very time consuming. And a lot of clinics just don't have time to do that because it takes time, to call the leads and everything. So we have the whole sales teams for you. And when you purchase the device, you will be able to you will be able to have access to our team so that we bring you customers and increase your revenue, such as like what Babish was showing you. So I will also leave the link to our website, on the description over here. You can go ahead, check our website. We have like dozens of like video testimonials on our website. So you can see we work with over like 200 clinics in UK and Ireland. And a lot of people offer like device-based, treatments. And yeah, you can go check it out. So yeah, appreciate it, Bhavesh.
Thank you, Theo. Thanks. So, as Theo was saying, like we will support you with driving clients as well. So it's not just the equipment, but we also give you the resources and the skills to do this as well. So I'll go back to my presentation. Okay, we're back on screen. Can everyone see it? Yeah. Yeah, great. So what we're doing right now, so we're going to instantly upgrade your clinic with the state-of-the-art technology and help you with the confidence. We'll provide all the training. We'll also help you attract valuable clients as well. And the other thing, it enhances your brand perception as well. Like biotech devices, obviously from Italy, there's a notion of style, flair. People think of Lamborghini, Ferrari. So you're going to add some more, flair to your business as well by adding these devices as well, which is great for your brand perception as well. And gives your clinic that competitive advantage too. So we've got an offer for a few units for the UK for this, and it's going to be like a first come, first serve, and it's based on a specific package. So what we're doing, we're helping you with a free marketing campaign, as Theo said, to generate 50 client inquiries. We're going to give you some extra towels, uniforms as well, and we're going to give you £3,000 worth of products with the device. And this is the actual offer. So we're calculating an interest-free payment option. And for the first 2 months, you're not going to have anything to pay. So once it's approved from our finance team, you'll get the delivery of the device and you will have nothing to pay for the first 2 months while we actually help you to build your business. And you'll be in touch with Theo and the team there to bring new clients in. So we'll include the delivery, the training, everything there. And here is a picture of our skincare range, Ren Live range. It's one of our most popular lines. So you'll get a whole package of products here as well. And yeah, so right now, what I'm going to do, I'm going to share a link where you can register to get your certificate, as well as my direct WhatsApp number. So if you want to WhatsApp me directly, or someone from my team is going to send you out a free ebook and book you in for a call with myself, and then we can meet you and arrange a demo and go through how we can help you as well. So yeah, if there's any questions, please let me know. And then yeah, thank you. Any questions, anyone?
I have a question to Theo, if it's possible.
Yeah.
Hi, Theo. This is Tatiana. I'm from sales team. And the question is to you, when you do a marketing and you attract requirements, do you do any calls to clients, and do you have any potential clients, not only requirements?
So I'm not sure I understand. Do we do any course, did you say?
No. Look, some of marketers, they
Yeah.
do calls to, for example, you
Calls, you mean?
you promise
Yeah.
50 requirements, but
Yeah.
these only requirements, not potential clients.
Yeah.
And but I know that some marketers, they are do calls,
Yes.
and they have potential clients for treatments. Do you do any such
Yeah. So
service?
our team basically makes the calls for you. So we generate the leads on Facebook and Instagram. We do the lead generation, and then we call the leads as well and take prepayment. So
Oh,
as far
okay.
as, yeah, we take prepayment, so we bring you customers, you know. As far as like the amount of like customers we can bring you, it really depends on your specific business. So the best would be to schedule a call with us, with our team, you know, and then we'll take a look at your business, take a look at your pricing, take a look at your location, take a look at, you know, your branding, and we can give you an estimate as to how many customers we can bring you on a monthly basis. But yeah, to answer your question, we'll bring you customers. We
Is it
generate inquiries and then we follow up with them and do that.
is this like a you do for all machine, or you have only specific treatments which you advertise?
Yeah, well, so like right now we're doing this partnership with the Biotec Italia. So we're really focusing on the this device. However, we work with clients with all sorts of device. So you could be for any device like HIFU, radio frequency microneedling, or even like injectables. So yeah, this works really for like any type of treatment as long as it's in the aesthetic industry.
So if you, for example, send this like a present from Biotech, yes,
Mhm.
50 requirements with 50 potential clients, or only requirements?
So we will generate at least 50 inquiries. And then based off like the criteria that I just mentioned before, your location, your pricing, and all these things, we will get you a certain amount of like customers from this. But I cannot exactly tell you like how many, because it's going to depend on your budget in terms of ads, how much you're going to spend on ad. It's also going to depend on your location. It's going to depend on the pricing and so on. Generally, we see our clients getting 15 to 30 new customers per month. That's kind of like what we're seeing on average. But for me to give you a specific numbers, like we would need to have a proper conversation so that we can really kind of give you a more precise quote, if that makes sense.
Okay, so now it's clear for me, because, for example, I'm sales team from
Mhm.
Biotech, so I'm not a client, but I'm interested for my future clients. Your have you promised 50 requirements, and how many real clients could be
Yeah,
from that requirements? So, uh, yes, okay, now it's clear for me.
absolutely.
Thank you.
Go ahead and book a call on our website, and we'll have a more detailed conversation, and we can tell you roughly exactly how many clients we can get you.
Thank you.
Appreciate it, Tatiana.
Great. If there's any more questions, or otherwise, Jout will send out some information and the certificate as well as the ebook as well. But yeah. Okay. Thank you, everyone. Thanks for your time, everyone. And
Thank you, everyone.
yeah,
Thank
let's
you.
Thank
Thank
you.
you.
Thank you, everyone.
okay.
Have a good
Bye.
day.
Bye.
Bye-bye.
Bye.
Have a nice
Bye
day.
Thanks
bye.
so much. Have a lovely day.
Bye. Bye.
Bye.
Bye bye.